One who's younger and otherwise healthy, have you done anything physical? Chest pain, it can be a very serious symptom, and we always have to rule out serious things like heart disease, blood clots. But yeah, it could be from weightlifting. You know, number one, it could just be traumatic from the muscles. You're actually tearing muscle fibers when you lift weights. But another thing we haven't talked about on the show is something called costochondritis. That's inflammation of the cartilage where your rib cage meets your sternum or breastbone. So if you have pain that you can reproduce just by pressing right where that cartilage is, it could be something like costochondritis. That can be caused from lifting, other strains. It can actually also be caused by infection, or after an upper respiratory infection, you can get that as well. It's something we see quite commonly. It's very painful, but we always have to rule out the serious stuff before we make that diagnosis.
I mean, it's actually a joint. It's a type of joint where your ribs join the sternum, and from all these things that you mentioned, the movement, coughing, things like that, very painful, but you have to rule out those other
So if you have chest pain,
that's a big thing you have to do when you see somebody with chest pain. Very often it is costochondritis, but you have to rule out that heart attack.